Has found that reducing our carbon footprint may have huge benefits to our health sector. In fact, it might save us $6 billion a year and thousands of lives. Well, Fiona Armstrong is the convener of the Climate and Health Alliance, and she joins us now. Good morning, Fiona. Thank you for your time today. What would you say are the key findings from this report that people should really pay attention to?
Hi, well, thank you for having me. We're very excited about this report. This is one of the first times that this evidence has been pulled together in Australia in a way that makes it very plain for people in the community, the media, and for policymakers to understand what the implications are for cutting emissions for health. And what they've found is there's quite a swag of health and medical research now that has started to look at what the benefits are to health from cutting emissions. And what they find is that there's very significant benefits to health, and that those health benefits carry will bring a huge financial saving, in many cases offsetting or even exceeding the costs of implementing strategies to reduce emissions. So it's a very good news story, and it's one that's not well understood.
We're looking now, Fiona, at the annual health costs of carbon. I mean, illnesses caused by coal-fired power pollution itself, $2.6 billion. I mean, we are talking huge numbers here.
Yeah, that's right, and those are very significant costs for health. The cost of air pollution from our transport sector is around $3 billion. So in all, we're looking at the costs of burning fossil fuels are around $6 billion in terms of the health impact on the community. So there are many benefits, however, that can be realised from moving away from burning fossil fuels in our energy sector, by moving to cleaner and more active public transport systems, by making changes in our food and agriculture sectors, through protecting our ecosystems. So all those strategies can bring very significant benefits to health, but unfortunately they've not been taken account of in the discussions to date about climate policy and emissions reductions. But if they were taken account of, what it would demonstrate that it's not just the cost that is being talked about, that there are many benefits as well.
So, Fiona, what are you hoping will be taken away from all of this? Because at the moment it's just numbers. Obviously you need action, but what sort of action are you hoping for?
Well, there's lots of actions that we can take. I mean, we do need to do the work here to actually quantify what the health benefits are from emissions reductions here in Australia. We've got this great research that's happening around the world, and some of that has been pulled together in this report. But it would be very helpful if we did, as they have done in Europe, to look at what the health benefits are of moving to stronger emissions reduction targets. And for example, in the EU, they looked at what the health benefits would be of moving to a 30% by 2020 target. And what they found was that just from the air pollution improvements, that the EU would save €80 billion a year by 2020. But importantly, what they did find is that those health benefits are most significant if action is taken immediately, and the benefits will decline if we delay.
Okay, some really good, interesting talking points there. Fiona Armstrong, convener of the Climate and Health Alliance, thank you for your time this morning.
Thank you.